Hmm. Oh, sorry. Hello, I'm Jacob Franco. Tonight's news, diabetes. 29.1 million Americans suffer from diabetes. That's nearly 10% of the American population. When diagnosed with diabetes, lifestyle changes are necessary. That includes multiple blood sugar checks a day, diet changes, exercise, just to name a few. With all the lifestyle changes necessary, it can lead to diabetic distress. Diabetic distress is an emotional hardship when dealing with chronic disease such as diabetes. 30% of diabetics suffer from diabetic distress. What can we do about this? Cognitive behavioral therapy, or CBT for short. What? I don't have a mental health illness. I have diabetes. Are you crazy? You don't have to have a mental health illness in order to benefit from CBT. CBT helps people manage and deal with stressful situations in life by giving them the tools necessary. Well, what is that going to do for me anyways? Well, since you have diabetic distress, CBT will help you find the tools necessary in order to decrease that stress, because diabetic distress correlates with hemoglobin A1C values. And by decreasing your diabetic distress, your hemoglobin A1C values will also decrease. How can we implement changes for quality improvement in our organization? By using the symptoms management model, we can make the changes necessary. The symptoms management model helps improve provider practice. That would be using CBT in diabetic care, as well as improving patient symptoms. That would be CBT would then decrease the diabetic distress patients are suffering from, as well as improve patients' quality of life. Using CBT, you would see a decrease in diabetic distress, as well as a decrease in hemoglobin A1C value, thus decreasing the risk of comorbid diseases and diabetes complication. Nurses' role is a key part in this implementation. Nurses would need to make sure all new clients are filling out diabetic distress forms and one every subsequent visit. Depending on the diabetic score, the nurse would then make sure the client is visiting with a therapist who uses CBT. The nurse would also make sure the client is regularly seeing the therapist to support diabetic distress. Nurses would also make sure to get the baseline hemoglobin A1C values and a hemoglobin A1C value every 3 months. It is important to continue monitoring the client's diabetic distress and hemoglobin A1C value since they are directly correlated. Why should we care? How does $245 billion sound? That is how much was spent in healthcare costs for diabetes in 2012. The annual healthcare cost for diabetics is $11,700, when the average annual healthcare cost for a patient without diabetes is just $2,900. But what about the lives of these patients? In 2012, 63,000 plus patients, diabetes was listed as the cause of death. Also, 234,000 deaths, diabetes was listed as a contribution to the death. Elevated hemoglobin A1C values can lead to diabetic complications, as well as increased healthcare costs and comorbid diseases such as stroke, cardiac disease, and kidney disease, just to name a few. By implementing the symptom management model, we can make changes in care, improve quality of life, improve medication adherence, decrease healthcare costs, and improve hemoglobin A1C values. It's time to apply the research and integrate evidence-based practice into our care for this organization. If all this is not concern enough to make a change in quality improvement, then trust me, I'm almost a doctor. Oh wait, I'm a nurse still, so technically I can't wear this yet.